Hello everyone, this is Eva Nolik-Smith with Yoga U Online, and I am very pleased to be here today with Dr. Timothy McCall.
Thank
Uh,
you.
Timothy is a medical editor of Yoga Journal and the author of the best-selling book and very popular book on the topic of yoga therapy called Yoga as Medicine, the yogic prescription for health and healing. He is also one of the co-editors of a groundbreaking new medical textbook called The Principles and Practice of Yoga in Healthcare. And as you can tell, Timothy is one of the leading pioneers in exploring the therapeutic applications of yoga for the field of medicine. So, Timothy, welcome. Thank you so much for joining us today.
Thank you. It's my pleasure to be here.
So, you are a medical doctor, but you also have extensive background studying yoga, and you had the privilege to study with some of the greatest yoga masters, Mr. Iyengar and TKV Desikachar.
I got to spend some time with both of them. I wouldn't say that I was like some people who went to India and spent years there, nothing like that. But I got, a few weeks with each of them, and I was very grateful for that. But I put them down in my biography mostly because I feel like a lot of the yoga I teach is very indebted to those two. And so, for example, I got some of Mr. Iyengar, but I had many, many years with Patricia Walden. Patricia Walden, of course, is one of Iyengar's senior yoga teachers in the world.
Yeah.
And so while I maybe only had a month in India and then another, week in Estes Park and then a little bit here and there with Iyengar, through Patricia and through other teachers, I got a lot of that tradition. Similarly, I spent some time in Chennai with Mr. Jessica Char, got to go to his home and interview him. By the way, we should say we're recording this the day after that it was announced that he had died. And
Yeah.
I actually feel like my own personal yoga, what I've been doing for the last years is more and more influenced by Krishnamacharya, Desikachar, and that whole lineage. That idea of the really breath-centered focus to the asana practice that he brought, I feel particularly indebted to that, and it very much shapes the yoga therapy work that I do.
Yeah, and he focused almost entirely on the use of yoga as therapy in his teaching.
Desikachar, absolutely. Krishnamacharya, of course, went through different stages.
Hmm.
He started off teaching the young boys of the Mysore Palace, and so they got the vigorous stuff that's become known as Ashtanga yoga. Um, and then he was very much a believer, as am I in the yoga therapy work I do, of adapting the practice to the individual. You know, and I think we have a huge misconception about this in the West. We're so dominated by the medical model. You have the diagnosis, whether it's, I offer a yoga U program on high blood pressure, but the fact is we take someone with high blood pressure, we don't just treat their high blood pressure. We treat their whole being. And we like to say in yoga therapy that we don't treat conditions, we treat individuals. And individuals have conditions. And so, one of the things I'm going to talk about in this Yoga as Medicine course, I'm going to bring a case history of a woman I just worked with a couple weeks ago.
Interesting.
And she is someone who, if you were to address one of her major problems, you would choose things that almost undoubtedly would contradict what she needs for a different of her major problems. And so, this kind of notion that here's the sequence for this disease, and it's so dominant in yoga. It's because of the medical model. In Western medicine, until we know the diagnosis, we don't know how to treat someone. If we don't know what you have, we might give you some drugs or something to try to reduce your symptoms, but we don't know what to do. Everything depends on having a diagnosis. But that's not true in yoga, or at least we don't need a Western medical diagnosis. We have our own diagnostic techniques, looking at posture, looking at the breath, studying Ayurvedic imbalances, psychology, spirituality. We can look for imbalances in all these things. That's what we target. And so, yes, we consider the medical condition when we treat, but it's down the list. And I actually feel in the yoga therapy work I do that the medical condition is often more indicative of what's contraindicated, what I'm not going to do, than what I am going to do. So you
Yes.
have diabetes and you have bleeding in the back of your eyes. Well, I'm not putting you upside down.
Right.
Okay. But how am I going to treat someone with that case of diabetes? It depends. What else is going on? What's their level of fitness? How's their back? What's their motivation level? What other conditions do they have that I might also need to consider? What are they Ayurvedically? How into yoga are they? How much experience they have? And
Right.
so much of these kind of canned sequences can't possibly consider all these factors because the person who's writing the sequence that appears in the magazine or the book has never laid eyes on the person who's supposed to do it.
Right.
That's not yoga therapy at its best.
Right. Right. Yeah. Very good point. And of course, when you talk about these points, the first thing that comes to mind is the word paradigm.
Okay.
That we're really, in a sense, operating within two different paradigms.
Yeah.
And we're seeing this whole effort towards integrating yoga as therapy within the healthcare system. But I often do not see a clear distinction and a clear awareness that the healing model and the healing approaches are based on two entirely different approaches to health and healing and two entirely different paradigms of what causes health and healing.
And they can work together. And so yoga is an example of a holistic enterprise by and large. Body, mind, spirit, environment, everything considered.
Right.
Western medicine tends to be more reductionist, look for the one cause or the one factor or the one chemical pathway we're going to try to interrupt, whatever it might be. That's a kind of reductionist way of thinking. Now, holism, within its big umbrella, welcomes reductionist thinking and reductionist tools
Right.
because they can be very useful. Reductionism, not so much with holism. I mean, it's changing a little bit, but by and large, and this is, I think, the problem that we're seeing, is that people want us to make yoga into a reductionist treatment.
Right.
Where there are, as a manualized series of 12 asana that will be done for the condition, which is X, Y, or Z, and the teacher will teach it this way and say these words and make this command, so it can all be standardized. Well, people have been willing to do that to get their foot in the door of the medical world, but that's really not what yoga is about.
Right.
It's a funny thing, sometimes not discussed, but in the yoga studies that are done, the yoga teachers can't help but slightly modify the protocols for the individual students in front of them, because that's what good yoga teachers do.
Right.
And so supposedly they're all following exactly the same protocol.
Right.
But if you're a yoga teacher and you can see that the version of triangle pose, for example, that is being mandated isn't working for the student who's right there in front of you, you're going to want to change it.
Right. Right.
And theoretically, that's not what you're supposed to do in a scientific study. But I know that sometimes this happens because teachers can't help themselves.
Yeah. Yeah.
So there is an imperfect match
Right.
between Western medicine and yoga. But I think what we can do is we can try to bring this holistic perspective into people's treatments, to respect their Western medical treatments, and in the case where people are in the Western medical world, to work in an adjunctive way, which, by the way, can make the Western treatments more effective and can lessen the side effects. This has been very clearly shown in cancer treatment.
Right.
People doing yoga actually wind up with less nausea, less depression, less appetite problems. Various things seem to get better by practicing yoga. Now, interestingly, yoga has, of course, never been shown to make anyone live longer from cancer. We suspect it's going to help. It's certainly going to help with quality of life, but maybe also making a difference in survival. Well, one concrete way that it could make a difference in survival is oftentimes we cannot give people the full doses of chemotherapy that are considered optimal for a treatment of cancer because the side effects are too great. Or the people turn them down because the side effects are too great. They won't go on with the treatment.
Mm.
Well, if you have something like yoga that can allow people to tolerate the side effects or have fewer side effects, they may in fact be able to do the treatment, which is theoretically more effective than if they only do a partial dose or a partial course of the time. So
Interesting.
that's one way I think that yoga can potentially actually help survival. And of course, we're getting indications. We know from Dean Ornish's work with men with prostate cancer that they're having epigenetic changes, changes in the cancer genes, the oncogenes potentially getting switched off,
Seriously.
which may
Interesting.
potentially then affect the rate of cure of the prostate cancer. Because, of
Mm.
course, we now know that if you have a cancer gene, but it's in the off position,
Right.
it's not going to affect you.
Yeah.
And it appears that things like yoga and meditation and other holistic approaches, diet as well, can affect gene expression.
Mhm.
And so, the old thinking, speaking paradigm, that for destiny is now completely out the window. We
Right.
now know that, in fact, you can change your genetic destiny, at least sometimes.
Right. Yeah. 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 That's very interesting. I hadn't heard of that study, but I have seen other things that have come out that uh, in a kind of tangentially shows a similar thing that um, the prognosis for cancer patients is also impacted not just by cancer stage but by vagus nerve resiliency.
Well, your body's stress system, of which the
Right,
vagus nerve is part of the parasympathetic nervous system,
right,
has a huge effect on all kinds of things. For example, like inflammation. And we know that many cancers are related to inflammation. And that chronic activation of the sympathetic nervous system, chronic underactivity of the vagus nerve and the parasympathetic nervous system can contribute to that pro-inflammatory state that may indeed fuel cancer. And by the way, many other problems. We're increasingly recognize the role of inflammation in disease of all kinds.
mm,
So yeah, it's a big deal. I think sometimes, we incorrectly say that yoga is just about reducing stress, and some doctors will say that, and
right,
it's much more than that. But the
right,
other thing is that reducing stress is a lot bigger deal than most doctors seem to think it is,
right,
because it can affect so many metabolic systems in the body, affect the immune system, affect the cardiovascular system. I mean, really everything.
right, right. Yeah, yeah,
It's,
exactly.
yeah.
It's very fascinating. There are more than, last time I checked, more than 3,400 studies on the health benefits of yoga or the general benefits of yoga.
Yeah.
And you have compiled a list
Right.
of the actual number of specific health effects. And last time I checked, you started out at around 50, and then it was 55, and now I think you're up to 75.
Yeah, and really, I could probably add a few more now. I probably should update that list sometime soon. But yeah, it was up to 75.
Yeah,
And again, I mean, the thing is, in yoga therapy, that's what we have medical evidence of. Okay, 75 different conditions.
right.
But the fact is, again, we treat individuals. We don't treat conditions. So pretty much, we can help anybody with any condition. We may not be able to cure their cancer. We may not be able to give them the result they're most hoping for. No guarantees, okay? But we can take people and generally make them happier, more at peace, improve their posture, improve their breathing, tamp down their stress levels. Many things that we can do that'll take, regardless of what you have, it can make your life better. Okay. Now, the fact is, when you're happier, when you're sleeping better, when your back hurts less, all the things that yoga can definitely do. From a holistic perspective, That's going to help cancer and heart disease and high blood pressure and osteoporosis and depression and anxiety and everything else to some degree.
Right.
Whether it's the one thing you want to happen, no, we can't guarantee it. And I think it's actually important as yoga teachers and therapists to not overpromise what we can do. And so I'd much rather you say, instead of, oh, I can help you with that back pain, say, I've worked with many people with back pain and we've had very good luck. That's the truth. Whether or not I can help you with your back pain, you don't know that. Because maybe that 60-year-old person who's coming to you with back pain actually has multiple myeloma or breast cancer metastases to the spine. And so maybe your beautifully thought out sequence of asana isn't going to do anything to help their back pain. Okay? That's a possibility you have to consider. We never know. But even if they do have that situation, and by the way, if there's ever a doubt, I always encourage yoga teachers to please refer patients, students back to their doctors. Mm-hmm. Get things. You have a funny feeling that something doesn't add up, or if you try for example, in the case of back pain again, you give them a few things that are often quite helpful for back pain, you don't see any response, starting to wonder, could something else be going on? Get them referred back to their doctor, get them checked out. At least tell them that's what you think they ought to do. Of course, they're adults, they'll do what they want to do. But I think you've got to at least get people plugged in to make sure there isn't something more serious that you're missing.
Right, right.
Yeah.
Yeah, and I think when people go through yoga therapy training programs, that is one of the things that, is emphasized. And many times yoga therapists are working more in a healthcare setting where they have people they can draw on. Let's talk a little bit about the development of the field of yoga therapy. We now have 1,000-hour certification standards. Many schools have been approved to offer and I believe the first several hundred yoga therapists are about to be certified and actually will be starting to practice, which is really quite a milestone.
Well, here's the thing. They've already been practicing.
Right.
So the question is, in the effort particular to integrate yoga into the medical system, there's been a feeling from within the profession that there need to be some kind of certification system. The International Association of Yoga Therapists, which I think you're referring to with your 1,000-hour standard, 800 after a 200-hour teaching program, basically. So they're trying to meet that need. Now, how recognized that will become in healthcare, whether this will become the universal standard, what other countries will do, because there's another certification system that's come out of India that has somewhat different standards, and so this is all getting sorted out. But in the United States particularly, and probably also in some other places, IAYT has had a lot of influence, and so we're seeing this. Now, really, I view there as being kind of two streams in yoga therapy. There's the branch of yoga therapy, which is really in the hospitals and trying to work in integrative medical clinics in this kind of situation. Then there's more of a kind of grassroots yoga therapy thing that's happening. And these people may not be certified. They may not be as interested in being certified. Some of them, of course, are going to be amazing therapists. And of course, in as much as we think that it's great to have a system of certification, it isn't a guarantee that someone's going to be a great therapist. We certainly see this in medicine. There are people who are board certified and have all the credentials and don't actually turn out to be great doctors. And there are other people who just are kind of like run-of-the-mill, seemingly physicians who are, for whatever reason, their bedside manner, their brains, whatever it is, they're amazing. And but not to denigrate the certification system, but it's not a be-all and end-all. And of course, yoga therapy is an endless field. 1,000 hours is really only touching
in the bucket. Yes.
Because you think about it. Yoga is an ocean. Yeah. Medicine is another ocean. Ayurveda, which I believe should be part of yoga therapy, or at least bringing those principles into evaluating the clients, another whole ocean. Mm-hmm. And so we're doing the best we can to master these things, to learn more, but it's infinite. You know,
Yeah.
even if you're only doing just structural yoga therapy, which is there's a branch of yoga therapy that's primarily about structure and
Right.
using asana primarily to try to change structure.
Right.
That's another ocean. And
Yeah.
and you have someone who's trained in physical therapy who may know all kinds of things that the average yoga teacher doesn't know, and
Right.
they carry this, very far.
Right.
But then maybe they're not considering Ayurveda in those evaluations.
Right. Right.
Maybe they're choosing things that structurally make sense,
Yeah.
but energetically, from an Ayurvedic or system or standpoint of the nervous system, don't.
Right.
So this is why I recommend a more integrated, more holistic idea where you're weighing the different elements and saying, great, this pose really helps with this structural problem that I'm recognizing, but I'm a little concerned about the effect it's going to have on vata derangement, the air element in SC
Mm.
increasing. And so I might choose a different pose or a different practice which may also address the structural problem, but in a way that actually works with. So I'll give you an example. Say someone's got a slouching, rounded shoulder,
Right.
C-shaped slump of the spine.
Yeah.
They've got vata derangement. So
Right.
they're excitable, they're anxious, they're not sleeping that well, they're talking a mile a minute, whatever. Their vata is too high. Okay. So back bends are often very helpful to kind of correct the posture.
Right.
Back bends can be very alerting to the nervous system and
Right.
potentially vata deranging. So one thing you can do is have someone do something like a cobra pose or a shalabhasana, locust pose, where the lower abdomen stays on the ground.
Mm.
Okay? When you do that, that is said to calm vata, even though it's a back bend. So that's choosing a particular version of a back bend that
Mm.
also is aligning with the Ayurvedic thing. And this is the kind of thing we're really trying to do in yoga therapy. We're trying to be as efficient as we can. If we can choose individual practices that address 4 or 5 or 10 of the different complaints the person has or findings or imbalances you detect, then you really got something that's gold.
Yeah. Yeah. That's beautiful. Timothy, you teach a course on yoga as medicine
Yes,
internationally. You travel
yes,
worldwide to teach
yes.
a weekend course in
It's
where
actually a 5 day, 5 day course.
5 day course.
5 day, 30 hours, 6 hours a day. It's basically an intensive where I kind of set it up in the first couple of days and then we break into groups and we start doing yoga therapy on each other, supervised by me and my assistants. And because I basically found that you can talk to people about yoga therapy, but until you throw them in the deep end of the pool, they don't realize what they don't know until they get there and they don't have it.
Right,
And,
right.
and, and
Yeah,
it just seems like it really is the best way I found to get people to start to grok some of the general principles.
yeah.
So, for example, I used to teach weekend workshops where there wouldn't be the casework. And one of my central points is that yoga therapy is not one size fits all. You've got to tailor it to the individual and their unique constellation of findings. Okay? And then I get back, and on Tuesday morning, there's email. I have a friend who has this kind of back pain. What poses do you suggest? And I'm like, did you like hear one word I taught in the workshop? Because that's, but I found that when actually people do it and they experience the thing of looking at the person in front of them, and then trying to figure out what's going to work, and then we come around and we tweak the practices. We say, okay, well, this is great for this, but what about this? How can we make this better? And so there's this real give and take.
Yeah, yeah.
The other thing that's beautiful about those workshops is we get people who are healthcare professionals, nurses, doctors, physical therapists, people who are yoga teachers, people who have various diseases, people who are trained in alternative modalities. And so there's this kind of coming together of skills. And
Right.
often I learn as much, I think, as the students do because I
Yeah,
see what people bring to it. So it's actually quite a nice little laboratory.
yeah. And is this also your approach to teaching the therapeutic benefits of yoga? Is that also a tool for self-care? Do you feel people learn some things that they can use in their own practice to tailor their own practice a little more specifically?
we're giving away one of the secrets in a sense of the workshop, but the fact is people don't realize that they're coming thinking they're learning about yoga therapy, but I'm actually making them do work on themselves.
Right.
So people always leave. One person just wrote me, I learned so much. He wasn't even one of the patients. He just said, I learned so much about myself in this workshop.
Right.
So, because, in a sense, the way you learn how to do yoga therapy truly and the way you learn to teach yoga truly is to do the work yourself. And how are you going to tell someone about looking at your psychological shadow side and really trying to work through your stuff if you've never done it yourself? You can't do that. And how are you going to teach someone shoulder stand if you yourself don't do shoulder stands? And, it has to on some level live in you.
Yeah.
So
Yeah.
definitely a secondary agenda of the yoga as medicine workshops is to get people looking at themselves, learning about themselves, learning how they need to adjust their own practice based on what's going on.
Right.
And again, there are many systems that have wonderful series of asanas, and you always do the same ones in the same order, whatever. And I think those can be great as kind of preventive medicine, but really for therapy, you want to actually personalize it to what's going on.
Right. Right.
Really, it's about that. And so I really hope that people end up learning a lot about themselves, where
Yeah.
they're Vedically, what their habits are, like really honestly looking at your samskaras, your habits as seen in yoga. And because yoga therapy, really more than anything, is about recognizing your samskaras and coming up with a program to systematically reprogram
Right.
your patterns.
Yeah.
It's
Yeah.
really what we do more than anything.
That's beautiful. And we are, of course, very privileged because you're going to be offering an online version of your course, focusing on yoga as medicine, a new paradigm for health, where you will be covering some of these principles and also showing yoga as a tool for self care. Tell us more about the course and what you'll be covering.
Well, I mean, we'll be covering a lot of what we just have been talking about,
Right.
of course. So holism and how you evaluate a student. I come up with this model that I call SNAPS, which is basically a way of thinking about a holistic evaluation and planning a program for a student. So SNAPS is an acronym. S stands for structure. So we look at posture, muscle tone, postural habits. Um, N stands for nervous system and the breath, since the breath is so tied into the functioning of the autonomic nervous system and is just a central tool that we use in yoga therapy. There's a lot of breath dysfunction, even by the way, among yoga teachers. Because I know this because I've been teaching these workshops for years, and I've seen many, many yoga teachers who've been doing yoga for years, and they're breath holders or they're mouth breathers or whatever it is.
Right.
And so that's a big part of it. The A stands for Ayurveda, looking to Ayurveda again is an ocean, but even understanding some of the basics can be very helpful in thinking about yourself, your yoga practice, your students, their habit predilections, and it really, and I should say parenthetically, when I was first writing the book Yoga as Medicine and first researching in the late 90s, early 2000s, I initially didn't plan to include Ayurveda in that book because I figured, oh, this is, stuff like Greek medicine with the bodily humors and the five elements or the four elements of Greek medicine, whatever. And I just said I was trying to, on some level, legitimize yoga therapy. And I thought if we had this kind of Ayurveda stuff, it kind of just sounded like that kind of Greek medicine stuff. And but as they sometimes say, the universe had other plans for me. I ended up writing most of the book as a scholar in residence at the Kripalu Center in Western Massachusetts. And the year I spent there, 2004, 2005, they just started an Ayurveda program. Vasant Lad, John Duyard, Robert,
Oh.
all these different people came through, and I got to take their workshops.
Oh, wow.
And I had a housemate. He's now passed. He was a wonderful Swami named Swami Shivananda. And this was not that Swami Shivananda from Rishikesh. This was actually one from the Netherlands.
Oh.
who looked like Kris Kringle, like those 19th century Kris Kringles, in except in orange instead of red. And he was an Ayurvedic practitioner, and he was my housemate for that year. And
Oh, wow.
he started talking to me and noticing things about diet, and we had lifestyle. We had many conversations,
Yeah.
and I had to admit that the stuff he was saying made sense.
Right.
And I tried the things he said, the very simple lifestyle advice, and I actually noticed they made a real difference.
Yeah.
And and then I actually, when I finished editing Yoga as Medicine, which was an incredible kind of Herculean effort to do that, I was really vata deranged, really exhausted. And I handed in the manuscript, and like 2 days later, I got on the plane to India. I took a taxi directly from the airport to an Ayurvedic center where I spent 41 days getting my first Ayurveda like intensive treatment.
Oh, great.
You know,
Great.
so
Yeah.
so
Yeah.
and you know what? It like yoga is something that builds over time.
Right. Right.
It starts slow and it just builds and builds and builds. You hardly notice it maybe in the beginning,
Right.
but over time you start to notice real changes.
Yeah.
And more than 10 years into doing that now, and wow, I continue to, and I spent 2 months with my teacher earlier in the year, and I'm heading back later in the year again. So
Right. Right.
yeah, and then
Beautiful
the
point.
last two letters of the SNAPs are P for psychology and S for spirituality. Psychological factors, spiritual factors, how those play in to assessing the patient. Now, of course, not everyone who comes to yoga therapy is going to be interested in talking about psychology or interested in talking about spirituality. And we never shove anything down anyone's throat. That doesn't mean you're not thinking about it.
Right.
So you know you got someone who's like kind of like pretty angry person, or like seems like they might be depressed, or
Right.
really seems kind of like spiritually adrift in their life.
Yeah.
You're going to notice that, and that may inform what you do to some extent. And maybe with ongoing working with the student, they may reach a point where they come to you and they want to talk about these areas that they didn't used to be interested in. And
Yeah.
that's one of the things that can unfold from
Yeah.
doing that.
Yeah. That's a beautiful point. Last question. I just wanted to address what we might call scope of practice. I remember when I took the massage training course some time back, there was this concept of scope of practice that made it really clear, what you can do as a massage therapist and what you cannot do. So, as
Yep.
a massage therapist, you can never diagnose, you can never treat. You offer wellness services.
Right.
And Yoga Alliance, as you know, just came out with a guideline that I believe addresses a similar point, pointing out to yoga teachers that they cannot treat and they cannot diagnose. And I believe that because it's a new guideline, there is some confusion around that. Does that mean that you can't help anyone, for example, who is, not sleeping well, or, have some of the kind of common non-disease ailments in Western society. And so it would seem to me that even though you're using the phrase yoga therapy, there really are two meanings to the phrase yoga therapy. There is yoga therapy as a treatment within a medical setting for people for a specific health condition with the purpose of getting a specific result. But as best I can tell, the vast amount of yoga therapy really focuses on wellness, increasing people's health and general well-being. And it's like you move, one leg of the table and the rest of the table come along.
That's
Could you
good.
talk about that point, the
Sure.
distinction between
Yep.
therapy and wellness and how that applies to your
Sure.
work?
Sure. Well, first of all, I mean, absolutely the business about diagnosis. I mean, certainly Western medical diagnosis, unless you have some specific training, you shouldn't be doing that. That you don't diagnose. Now, a good yoga teacher, in fact, is going to notice when some people have scoliosis or some people have an SI joint problem, and they are going to kind of know about a diagnosis. But you just need to be careful, and you probably don't even say it when you recognize it. You may point someone back to their own physician, In the case of SI problems, unfortunately, many physicians don't know anything about them. um, okay. Now, again, we don't treat conditions, we treat individuals. So I'm going to detect various imbalances yogically, your posture, your muscle tone, your awareness or lack thereof, your Ayurvedic balance, these kind of things. These are not Western medical diagnoses. And someone's got insomnia, they may have a rajasic mind, they may have hyperactivity of the sympathetic nervous system. They may have lifestyle habits, caffeine late in the day, dinner too close to bedtime, things that are amenable to yogic and Ayurvedic lifestyle advice. Okay, so what we're doing, in a sense, we treat your cancer not by treating your cancer. We treat your cancer by looking at your imbalances and trying to find ways that we can bring your imbalances, seen holistically, into greater balance, with the notion that if you do that, cancer tends to improve, high blood pressure tends to improve. Everything tends to get better when we take care of people holistically. So I like to say we don't treat, or the way we treat any individual condition is by treating the overall condition of the individual.
Right, right.
Okay, so I think this word treat is a tricky one, and you can get yourself in trouble with it. And even the word therapy, you can get yourself in trouble with it. Leslie Kaminoff, a number of years ago, decided he wasn't a yoga therapist anymore. He was a yoga educator. Well, you know what? Leslie Kaminoff, love him, but he's a yoga therapist. But legally speaking, it's safer to call himself a yoga educator. Okay, fine, great. Use whatever euphemisms you need to do. We are helping people who have medical conditions. We're not treating them. We're not offering treatment in the sense, and we are not guaranteeing results. The people who refer to you may have a specific aim. And the person has cancer, they want to be cured. Maybe what you're going to do with someone is make them sleep better, reconcile their relationships with their family that have been ostracized, and come to peace with their diagnosis, which turns out cannot be cured. That may be what unfolds. That would be a very successful result from your therapy. Not what was anticipated, not what was most desired, but something that in some funny way might be better than what was desired. Or maybe because of that, maybe not. But you know what I'm saying? There are times, when I started yoga and I first committed to doing a daily practice, I really wanted to be more flexible. Okay, that's what I thought was like really going to change when I started doing yoga. And you know what? I'm still not that flexible. Turns out I have a fused spine I didn't know about, and some reasons why that's the case. But the fact is, I'm not that flexible. But what I've gotten from yoga is so much better than being flexible that we don't want to even limit ourselves to just treating the condition. We're treating the human being, trying to help the human being live their life more skillfully and effectively and mindfully and lovingly. And people are going to argue about whether that's treatment and blah blah blah. I don't waste any time on that stuff. We're trying to help people, and let the lawyers and the politicians and the regulators worry about all that stuff. I don't care about any of it.
Right. Yeah, and coming back to the whole thing about paradigm, I'm sure you're familiar with the difference between the medical model of health and disease, where like you're either healthy or you're sick. It's an either or. And the wellness model that sees things more as a continuum, and you can be on a long continuum with disease and morbidity on one end and perfect health on the other. Most people are somewhere in a scale in between, and you can help people slide up the scale.
But I'm gonna say even that's a simplistic model, because you can have someone going back to my SNAPS format. You can have someone who's structurally at a very high level, nervous system low level, Ayurveda kind of balanced, psychology big mess, whatever. So it's like it's not just like, oh, everything is like a a knob on a stereo. No,
Right, right.
it's way more complicated, way more nuanced,
Yeah,
and way more interconnected. So I talk about structure, nervous system, Ayurveda. They're all interrelated.
yeah,
What you do to one tends to have ramifications on the other. So it's
yeah,
the reality is yogically seen, we're one unified whole. Okay, and so we talk about body and mind as if they're connected. They're not connected, they're two parts of the same thing.
right.
The connected is just that we have one word we call body, which lets us think about one aspect of our unified self, and another that we call mind that lets us talk about another aspect of our one unified self.
Yeah.
And we say, oh, they're connected. Isn't that interesting? Aspects of the same thing are connected.
I know, yeah. Yeah, that's a beautiful point. Well, wonderful. Timothy, thank you so much for joining us. And
Pleasure.
you have so much great knowledge to offer, and we really appreciate you offering the course and can't wait to spend some more time with you and learning more about your very, I wouldn't say innovative, but definitely, in depth and much more practical and organized approach to helping people take advantage of the health benefits of yoga. So thank you so much. Really appreciate it.
Thank you.
Thank you.